Whenever we plan to undertake hip replacement surgery, it's important for patients to understand the risks and the benefits of that procedure. Those risks will relate to you as an individual, but there are a number of risks that relate to all patients. Certainly when you have a hip replacement, there's a risk of blood loss. It's unusual to require a blood transfusion, however we would always like to know your wishes should that be necessary. There's a risk of infection, and this is something we take very seriously, as an infected hip replacement is a terrible outcome. We'll give you antibiotics at the start of the surgery, and we'll clean the skin with the coloured skin preparation that may be either a brownish colour or a pinkish colour. We wear special clothing, there is airflow systems in theatre, and the implants are all sterile packed. That being said, the risk is still somewhere between 1 in 200 to 1 in 300, and this is a significant risk. If you were to attend on the day of surgery with a cut or a scratch on your leg, a water infection or a chest infection, then we postpone the surgery until you were as healthy as you could be on the day of the operation. There's a risk of damaging nerves that are near the hip. The sciatic nerve runs behind the hip, very close to where we operate. We're trained to look after this and protect it. However, rarely it can get bruised or stretched. This can lead to numbness or weakness below the knee, and that can take weeks or months to get better. Again, this is a significant outcome, and it's important that you understand that it's a possibility. Hip replacements don't last forever. If a hip replacement for you lasted less than 15 years, I'd be really disappointed. We know that there's good evidence that hip replacements put in many years ago have lasted over 20 years in 85% of the cases, and over 25 years in 65% of the cases. We hope that the technologies we use now will allow our hip replacements to last even longer than this. There's a small risk of fracturing bones when we try and replace them. That risk is small, but will relate to specifics about you as a patient. Things like steroid use, osteoporosis, and other conditions may increase your risk. That being said, we're very careful with how we do it, and we have plans in place should there be problems. One of the things that patients worry about when they learn about hip replacement surgery is the risk of dislocation. This is where the ball can come out of the socket. This is a type of hip replacement that many patients will have, and a ball can only go so far before it will come out of position. If this does happen, it can be put back in without major surgery. Around the time of surgery, you'll be given a lot of advice by your physiotherapists and information by the team in the wards and around the theatres to help you reduce your risk. We used to be very cautious about how we managed our patients and placed lots of restrictions on their activities afterwards. We've become a lot more confident in our outcomes, and really there'll be very few restrictions on you which we can discuss face to face. We'll try and get your legs the same length at the end of the operation. It is a technical aspect of the procedure, and we do our very best to get that right. Sometimes there are compromises that have to be made with getting the hip stable compared to getting the leg lengths absolutely perfect. That being said, we generally like to get everything completely right. Small differences in leg length are often not noticed. Differences of more than 5 to 10 millimeters, in particular when the leg is lengthened, are often noticed, and there are things that can be done about that longer term. Hip replacements are painful. It's important to understand that it won't be pain-free. What is true though is that the pain that you have after hip replacement surgery is quite different to the pain of arthritis. It will often feel like you've had a big kick in the bum, and this pain will improve significantly over the first 2 weeks. You'll be given plenty of painkillers around the time of surgery, and you'll have pain relief to take home, which will make this all a lot easier. You may notice quite a lot of swelling in your leg, which may last weeks to months. Certainly if this swelling settles overnight but gets worse during the day, this isn't really anything to worry about. Painful, red, swollen calves can be a concerning feature, and we'd want you to get in touch with us after surgery if that was the case. More often than not, it's nothing to worry about. You'll have a scar over your hip, and we can explain exactly where that will be when we see each other face to face. The stitches we use are dissolving stitches, and there'll be glue and paper strips plus a dressing. That dressing will be waterproof, and you will be able to shower with that on as soon as you go home. Generally, we like to keep our wounds covered for the first 2 weeks and get them checked with the GP practice nurse or in the hospital 2 weeks down the line. I prefer my patients not to bathe or swim for the first 6 weeks until I've checked the wound at that further follow-up clinic. There is a risk of blood clots that can start in the legs and travel around the body. Most patients will be given injectable blood thinners whilst they're in hospital and tablets when they go home. Again, this will depend on the specifics of your medical history and the medications that you take at present. Obviously, if you have any questions about the surgery that you're going to have and specific risks that you're worried about, then I'm very open to you contacting me via my secretary or looking at the frequently asked questions page on the website.